Good afternoon, everyone. I am Joy Hatchett, the acting insurance commissioner here in the state of Maryland, and I'm very pleased to welcome all of you to our virtual public hearing on the 2025 proposed health insurance rate filing. Before we get started with the information for today, I just want to take a couple of minutes to go over some very brief housekeeping rules. First and foremost, as you just heard, this meeting is being recorded, and that recording will be available on our website in 2 or 3 days. You will have the opportunity on the website to review the recording along with any public comments that we receive in connection to this rate hearing. And there may be a few of you that joined us today, but that did not sign up to speak. What you'll need to do is just enter your name and your affiliation in the chat box, and provided that time allows, you will get an opportunity to speak at that point. If for some reason either you aren't prepared to speak today, or you can't get yourself off of mute, or you have ended up calling in, you also are able to submit comments in writing to the administration, and we will consider those comments as well. What we would ask is, during the course of this particular hearing, if you keep yourself on mute, that helps to reduce the amount of noise and background noise unless you're actually speaking. And as I said, there will be the opportunity for you to speak at the end of this, both those of you that signed up, as well as those of you that enter your name and affiliation in the chat box. Now, what we're going to do today, as I indicated, is this hearing is to discuss the 2025 Affordable Care Act health insurance rate filings that have been submitted by the Maryland insurers that are participating in the individual, non-Medigap, and small group markets, those that have been filed here with the Insurance Administration. Our chief actuary, Brad, will be going over at a very, very high level a summary of what is considered in those rate filings. And then what we'll hear is from each of the carriers some information that they wish to speak to today. And we will also, as I indicated, allow people to submit written comments if they would like. And what I'd like to do next is to introduce the people who are on our panel today. So our chief actuary, Brad Bobham, senior actuary, Adam Zimmerman, principal counsel, Van Dorsey, and our director of communications, Craig I. And at this point, what I'll do is I'll turn it over to you, Brad, for you to give a brief overview of what has occurred up to this point.
Thank you, Acting Commissioner Hatchett. So at this point, I'm going to go through a brief slideshow to give a summary of what has been filed and what we were looking at. So Craig, if you could go to the first page of my slides, please. Sorry, Craig, do you have my slides, or should I pull them up myself?
I do. I was just having some difficulty. I will get them up shortly.
All right, thank you. All
You
right,
see
thank
the
you.
slides?
Yeah, this is it. Thanks, Craig. If you could go to the next slide, please.
Yeah.
All right, so for 2025 in the individual non-Medigap ACA marketplace, the average requested rate change is 6.7%. This is a little bit higher than trend. The average trend is about 6.2%. The rate change requested varies by carrier. The lowest is 4.7%. That's what Blue Choice is asking for. And the highest is 14.2%. And then that's what the Care First PPO is asking for. In addition to the getting rate increase requests, we've also received a filing from WellPoint, which has new plans that are going to be available statewide in 2025. So this is now 3 carriers in the past 4 years who have entered the Maryland individual marketplace, and brings the total carriers in Maryland up to 5. And that compares to where it was as recently as 2020, with only 2 carriers, Care First and Kaiser, in the marketplace. So that's really great news. And you know, we're seeing the more competition help push the rates down. In general, the requested increases from 2025 are ending up in rates that are still approximately 17% lower than they were in 2018. So this is now the 4th year in a row that we've seen increases, but the state reinsurance program had 3 years in a row of double-digit decreases, and had a cumulative decrease of about 32% over those first 3 years. And so we are still, on absolute dollars, you know, significantly lower in premium than we were before the state reinsurance program started. In general, the total market enrollment, both on and off exchange combined, has grown by 16.3%, which is 37,600 members between April 2023 and April 2024. The 269,000 total enrollment that we have is now the largest since ACA has began. So that's really great news. That is driven in no small part by the Medicaid disenrollment. That has finished as of June, I believe. And so now all the Medicaid people who were frozen during the COVID public health emergency are now removed from Medicaid and back into the private market. Right now, carriers are projecting a relative morbidity equal to that of the individual single risk pool for these members. I would say that's still to be seen, and there is reason to believe that this group of people who had Medicaid could be healthier than the normal uninsured person, because they weren't uninsured, because they had access to care. Next slide, please. This is just a snapshot of where Maryland's premiums lie right now. This is the premium for an age 40-year-old. For Maryland, we only have one. None of our carriers geo rate, so this is the age 40 premium wherever you go in Maryland. For the other states shown, this is the average across all zip codes. All of this information is compiled by the Kaiser Family Foundation. But the point is just to show that Maryland right now has some of the lowest premiums in the country. In the upper left, our bronze premium of $256 is the absolute lowest in the country. It's 30% below the U.S. average of $364. And you can see, you know, I put the bottom 5 states there, and you can see that, you know, we are the lowest, even amongst the low. And then for silver, you can see that we're the 3rd lowest at 342, but that's still 27% below the national average. And for gold, our 336 is the lowest, and that's 31% below the national average. So I just wanted to put everything in perspective that you know, we're reviewing a rate increase off of you know, what are our low premiums on an absolute basis. And that is, you know, driven once again by our state reinsurance program. Without the state reinsurance program, our premiums would be much closer to the U.S. average. maybe still a little bit below the US average, but much closer to the US average, but without that state reinsurance program. Next slide, please. So in the other marketplaces, in the small group market, we received an average request of 6.1% over all 4 quarters, with requests varying a little bit more by carrier from 4.9% to 23%. And in the small group marketplace, we're still seeing enrollment decline. Enrollment fell by about 5.2% over the last year, leaving the pool at just over 227,000 members. And this is an ongoing pattern. We've been seeing, small single-digit decreases in small group enrollment over the last 4 or 5 years as the individual market has grown. And they're not necessarily related. We're still not sure where exactly the small group people are going to. It's probably a mix of PEOs and level funded insurance and just going uninsured and not having a product. And also ICHRAs are growing in popularity. And each of those things are difficult to track, so we don't have a good idea of where this enrollment is going. And as far as standalone dental goes for the individual market, the average filed increase for 2024 is a 2.4% increase. This has rates ranging from -5% to +18%, varying by carrier. And for the dental segment, enrollment was steady at 96,000 over the past year. And that represents about 36% of the individual market choosing a dental plan. Next slide, please. So this is a comparison of the individual and small group allowed PMPM. So the allowed PMPM is the claims amount before any cost sharing has been applied. So it's the total of what's going to be paid from both the insurance carrier and from the member in co-pays or co-insurances or deductibles. And this history just shows that back in 2014, you had small group and individual at about the same level of allowed PMPM. And then for the next 4 years, you saw the individual market have large double-digit worsening of morbidity, and the claims PMPM really skyrocketed and started to be well in excess of small group. And that's that ratio on the far right. I have the individual to small group ratio. So you can see that by 2018, the individual claims were 1.314, 31.4% higher than the small group claims. Since the reinsurance program has started in 2019, we've seen this kind of reverse a little bit, and we have seen evidence that there is, some morbidity improvement in the individual market, and things are closing the gap. But you can see that as of 2023, there's still a large gap. The small group has claims of $522 a month, and individual has claims of $654 a month. That's 25% higher level of claims. And so, this is why I said the only reason why we are able to be cheaper in the individual market is because of that reinsurance program. The reinsurance program is taking about 35% of claims out of the individual market and leaving it with a lower claims basis on which to set premiums. All right, next slide, please. So as far as the major assumptions that we're looking at for our filings, our number one assumption is probably trend. Overall trend assumptions across both markets averages 6.4%, ranging from 5.3% on the low to 10.5% on the high. In general, carriers are using a drug component of trend that is significantly higher, 10% on average, than medical components. And there is also variance within the medical components. All of the carriers have to file an assumed trend by inpatient hospital, outpatient hospital, professional, other, and drug. and you know, you can see a good deal of variation within those service categories. Next biggest assumption is morbidity. That's basically the change in the average health status of the pool. So if you have new entrants coming in, or if you're losing entrants, is your pool getting sicker or healthier? The individual market this year grew by 16%, and new entrants skew young based on MHB data. And you know, as I said before, you know, we believe there's a potential for morbidity improvement here. Risk adjustment is another big key assumption in the ACA marketplaces. Risk adjustment has below average risk carriers transferring to above average risk carriers. And that risk changes significantly year from year. So, you know, we are looking at each carrier's assumptions as to, you know, how their risk is going to vary according to the risk of the marketplace, and to make sure that their transfers are commensurate. Reinsurance is a large assumption in the individual market only. As I've been saying, you know, about 35% of claims from the total risk pool are removed, but that varies by carrier. So each carrier models what percent of their claims they believe are going to hit that $20,000 or $21,000 attachment point. And we're reviewing each of those models as well. And then G&A and broker commission. This ranges from 9 to 18% of premium. It's constrained by the minimum 80% loss ratio, which is another thing we look at. We ask all carriers to project that they are in compliance with the 80% minimum loss ratio, so they won't be paying rebates. And then lumped in with G&A and broker at some time is also, you know, risk margin or profit margin. You know, after everything is paid for, all the claims are paid for, and all the actual expenses are paid for, what margin is going to be left over. And in the ACA marketplaces, you know, the margins range from break even to you know, 5% on the high end. Next slide, please. All right, we have posted all of the rate filing documents at our public website. It's www.healthrates.marylandinsurance.state.md.us. You can review all these rate filings on that site, and you can submit comments. The comments are going to be open through Friday, August 9th. And you can also find answers to frequently asked questions about the rate review process. Otherwise, you can contact either Craig or me if you have any questions, or if you want to submit any comments. Next slide, please, Craig. So this is a more detailed slide of what carriers filed. It went out with our press release. The second to last column shows what is being filed this year. You can see in the first row, CareFirst Blue Choice is asking for a 4.7%. CareFirst PPO are both asking for a 14.2%. Kaiser HMO is asking for an 8.5%. Optimum Choice is asking for 6.7%, and Aetna is asking for 12.4%. And then, as we said, we have WellPoint is the new carrier. Next slide, please. This is the same detail for small group. I'm not going to go through all of them, but I just wanted to highlight the small group rates, in addition to also changed by quarter, in addition to changing on the annual basis. So we have quarterly rate increases that aggregate to that average 6.1%. So you can see that the early quarters of the year have a lower increase, the later quarters of the year have a higher increase. And a lot of that is driven by what was filed last year and how this year's trend compares to last year's trend. But we're in general focused on that 6.1% average. Final slide, please, Craig. And then it just shows what was filed for the individual dental. As said before, you know, the one carrier, Delta Dental, is filing up to an 18% increase. But in general, the average is only 2.4%, with Care First filing for a 5% decrease. All right, that's all my slides, Craig, so thank you.
Thanks, Brad. And so at this point, we're going to hear from the carriers who wish to speak regarding their particular filings. And we'll start with Aetna. And for Aetna, if you could please state who is actually representing the carrier and go ahead and start with your comments at this point.
Hello, this is John McCatchy, Senior Manager with Aetna. I'll be presenting our commentary. Good afternoon. Thank you for this opportunity to present information on our 2025 ACA portfolio. Aetna is working hard to make healthcare simpler, easier, and more convenient for the people of Maryland. In addition to our current small group presence, we are now in our first year of the individual market, and we are excited to continue in 2025. I will first talk about our small group offerings. In the small group market, Aetna files rates for two legal entities, our HMO entity, Aetna Health Inc., and our PPO Aetna entity, Aetna Life Insurance Company. Approximately 11,700 individuals in Maryland are covered under Aetna's small group policies as of April 2024. I would like to start off by noting that the changes discussed here are average rate changes. The exact rate change will depend on a number of factors such as benefit design and employer and employee characteristics. To develop these rates, we took the adjusted historical claims experience from 2023 and projected it forward to 2025. There are four main drivers for these rate changes. 1, medical costs rising. 2, plan designs changing. 3, estimates of the average morbidity in the ACA risk pool. And 4, other items, including claims experience being different than we expected. I will discuss each of these items in more detail. For HMO, our average rate increase is 17.3%, and for PPO, our average rate increase is 21.7%. Together, that is about 19.2%. We have filed 12 plans for HMO and 21 plans for PPO. 3 HMO plans and 3 PPO plans are offered both on and off exchange. The remaining 9 HMO plans and 18 PPO plans are offered off exchange only. As I mentioned, this is a weighted average of the expected year-over-year changes. The exact rate change will depend on what benefit plan the individual chooses, when the member's group contract renews, the age and family size for enrolling employees, and employer contributions. First quarter consumers will see a rate increase of 16.1% for HMO and a rate increase of 20.5% for PPO. I will now review the main drivers of these changes in more detail. 1, medical cost rising. Medical and pharmacy costs increase mainly for 2 reasons. Providers raise their prices and members get more medical care. Our projected paid trend for medical only is 10.2% and RX is 11.2%, and for a combined trend of 10.5%. 2, plan designs change. Changes to cost sharing for some plans were made to comply with the actuarial value requirements and/or make our plans more attractive to consumers. On average, this increases costs 1% for HMO and 0.3% for PPO, for a combined 0.7% increase. 3, our estimate of the average morbidity in the small group risk pool. Our estimate of average population health and the expected risk adjustment transfers for ACA products have changed to reflect new data on market average premiums and population health. Small groups purchasing insurance in the marketplace are healthier than we initially anticipated. These changes are expected to decrease costs by 3.5%. 4, other items. 2023 claims experience is different than we expected. Other items contribute an increase of 9.2%, including claims experience emerging differently than we originally anticipated. Now I will talk about Aetna CVS's individual ACA offerings. In the individual market, Aetna CVS files rate for one legal entity, which is our HMO entity, Aetna Health Inc. Approximately 3,000 individuals in Maryland are covered under Aetna's individual policy as of April 2024. Once again, the changes discussed here are average rate changes. The exact rate change will depend on a number of factors such as benefit design and age. Our average rate increase is 12.4%. We have filed 9 plans, which are all offered both on and off exchange. The primary driver of the 2025 rate increases for most of our plans are rising medical costs. Our projected paid trend for medical only is 6.3%, and pharmacy is 2.9% for a combined trend of 5.7%. We also wanted to update you on what Aetna is doing to keep premiums affordable. We are taking a number of steps to keep our products as affordable as possible and to address the underlying cost of healthcare. These actions include 1, developing new agreements, arrangements, and partnerships with healthcare providers that base provider compensation on the quality of care and not the quantity of services. 2, creating medical management programs that address potential health issues for members earlier, improving health outcomes and reducing the need for high-cost healthcare services. And 3, working to reduce the ability of out-of-network providers to collect unreasonably excessive payments for services they provide. Again, thank you for this opportunity to present to you today.
Thanks so much. And next, we'll hear from the representative for Care First. And once again, please state your name before you start speaking.
Great. Thank you, Commissioner. I appreciate the opportunity to testify today. My name is Pete Berry. I'm the Chief Actuary for Care First Blue Cross Blue Shield. Care First participates in the ACA markets in both individual and small group or HMO and PPO plans, and I'll be speaking to those rates today. I'm going to start with the individual HMO. That's where the bulk of our membership is, about 123,000 members. As Brad mentioned, we have a very moderate rate increase this year. We're requesting 25 at 4.7%. Generally speaking, what we're seeing there is the claims trend is about what Brad talked about, 6, but we're seeing downward pressure on our rates due to risk adjustment, which I'll talk about briefly. As Brad also mentioned, Medicaid redetermination added about 37,000 members to the individual market. We did not receive very many of those. Our analysis shows that most of those went to United, which makes sense given the auto assignment for Medicaid redetermination. And to the extent that those members were relatively healthier than the average, our pool became relatively sicker, which increased our risk adjustment receivable and put downward pressure on our rate about 1 to 2%. And that's kind of how we landed at the 4.7. We are going to have to track that very closely because our market share has dropped substantially with that additional membership, which makes risk adjustment more volatile. While that's all very good news, we are seeing upward pressure in our trend due to drug, like the rest of the industry. And so we're having to keep our eyes on that very closely as well. Moving to the PPO. The PPO is a much smaller pool. It represents about 13% of our individual membership. These folks are very, very sick. They have about 4 times the morbidity of the HMO members. There is a significant churn here of membership. Very high morbidity with low membership leads to a lot of volatility, and we've seen that over the past few years. Our requested increase is 14.2%, but I want to provide some context for that. That's made up largely of 3 items. The first is the underlying claims trend, which we've talked about. The second is the increase in the attachment point to the reinsurance program, which puts more liability on the plan, and that drives it up. And then the third is an increase in the morbidity of the members that we're seeing starting in 2024. That's driving up the trend. We're seeing things like increase in dialysis, sepsis, leukemia. We're continuing to see very high outpatient mental health utilization post-pandemic. All of these things are driving up our costs. Again, it's volatile because it's low membership and high morbidity, but it's also volatile because of its dependence on the reinsurance program. As Brad mentioned, about 37% of the claims are paid by the reinsurance program. For this population, it's half of the claims are paid by the reinsurance program. So a small change in that assumption can move the member rate increase dramatically. Over the past few years, we've seen that volatility manifest itself in these increases bouncing around. So for 2022, we saw about a 12% decrease in rates. And then the next year, we saw that rebound to a 13% increase in 2024. we saw a 2.5% decrease, and now we're back up to a 14.2. So it's just the nature of this pool being relatively small and very sick. We're continuing to work with the MAA actuarial team in reviewing our assumptions, and we look forward to bringing this to a good conclusion, by the end of August. Moving over to small group, it's a little bit more straightforward. Our HMO product has about 4 times the membership of our PPO product, so it is the bulk of our membership, about 3/4. Our January over January rate increase is 3.2%. That's equivalent to the 4.9 average that Brad mentioned. So very moderate. We've seen membership decreasing since the beginning of 2023 after seeing several years of increases. And as Brad mentioned, the whole market is decreasing. We're tracking that very closely. I think that we see the same thing on trend. While they're moderate here, we are seeing upward pressure due to prescription drugs. So that, again, that's something we're paying very close attention to, but we're very happy with a 3.2% for January over January trend after reducing the increases in July of 2024 that we originally filed. For PPO, a similar story to HMO. It is a bit more volatile due to the low membership, but still a moderate rate increase. January over January, 6.2, right around trend. That's the 7.5% that Brad showed on his slide for the average for all 4 quarters. Historically, this population has been very stable. We've had single-digit rate increases in this block going back 10 years, so nothing new this year with our 6.2. And the composite of both of those for January over January comes out to about 3.9%. So that concludes my testimony. Brad, I'd be happy to answer any questions you might have.
Thank you. And
Sure.
next, we'll turn it over to Kaiser.
Hi, everyone. My name is Stephen Chuang, and I am a Senior Actuarial Associate at Kaiser. So today I'll be speaking to our individual and small group rate filings. I will begin with our individual filing. This rate filing represents 18 plans offered both on and off exchange. Several plans received minor changes to keep plans within the appropriate actuarial value range. 2 on-exchange plans were removed from the portfolio to comply with the 2025 plan limits, 1 gold plan and 1 silver plan, so that there's now a maximum of 3 on-exchange plans in each metal tier. These plans currently service approximately 60,000 members throughout Maryland, which is around the same as our 2023 average. For 2025, we have filed for an average rate increase of 8.5%. Depending on the exact plan, rate changes may vary from a 6.2% increase up to an 11.2% increase. There are several drivers of the rate increase, and some of the largest are 4.7% from trend impact and 2.5% from margin improvement. If our filed rates are approved, we expect to realize a margin of -3%, which is still a loss on this block, but is an improvement on our 2024 filed rates. Other drivers of the rate change would include factors such as base experience, demographics, and risk adjustment. Overall, these drivers would account for a small percentage of the rate change. The rate increase produces a projected medical loss ratio of 91.3%. The state-based reinsurance program has had a significant impact on our rates. Without this program, our estimate is that the 2025 rates would need to be 30 to 40% higher than filed. And next, I will speak on our small group filing. For the small group market, our filing represents 60 plans, including both on and off exchange, and 2 different provider networks. There were no new plans added or discontinued for 2025. These plans currently service approximately 9,300 members throughout Maryland, which is slightly lower than the 9,600 in 2023. We have filed for an average rate increase of 8% for 2025. The rate changes vary from 7% to 9.4%, depending on the plan and when the group renews. There are several drivers of the rate increase, and some of the largest are 4.8% from base experience claims and 4.7% from our rating trend. Other drivers such as demographics, risk adjustment, and admin would account for a small percentage of the rate change. And the rate increase produces a projected medical loss ratio of 91.7%. Medicaid redetermination has impacted our membership, mostly in our individual market. Around 3,600 formerly KP Medicaid members were added to our Maryland individual market from 2023 to 2024. We don't have a good way of quantifying the morbidity change driven by this migration and have assumed no impact in our 2025 filing. And this concludes my prepared statements. Are there any questions? Thank you.
Thank you. So next we'll hear from United.
Good afternoon. Yeah, thank you to Commissioner Hatchett and to the Maryland Insurance Administration for the opportunity to present today. My name is Ryan Morgan. I'm an actuary with United Healthcare, and I'm here to discuss the 2025 small group and individual rates that United Healthcare has filed with the Maryland Insurance Administration. United Healthcare continues to offer small group policies on 4 legal entities: United Healthcare Insurance Company, Mamsie Life and Health, Optimum Choice, and United Healthcare of the Mid-Atlantic. Across all 4 of these legal entities, we are proposing 118 unique small group plans in 2025, 16 platinum, 57 gold, 41 silver, and 4 bronze. And as we've done in the past, approximately 20% of these plans will continue to be available both on and off exchange, and the rest are available off exchange only. For the small group market in 2025, we submitted our rate filings back in May and requested the following rate increases: 5.4% for United Healthcare Insurance Company, 5.2% for Mamsie Life and Health, 5.7% for Optimum Choice, and 12% for United Healthcare of the Mid-Atlantic. That last one was higher primarily due to risk adjustment differences between that, the risk pool of that, and the others. And also that's the smallest block of the 4. And please let me be clear, as others have said too, these represent an average change for each respective licensed entity. The actual change for any specific group could be higher or lower due to a variety of factors. One thing I did want to touch on, though, one of the primary drivers obviously is trend. United Healthcare conducted a full review of all components that contribute to trend, looking at unit cost information, utilization information, deductible leveraging, and all these components were looked at for inpatient, outpatient, professional, pharmacy, and other services. And so based on this analysis, our filed claims trend was 9.0%, and our filed forward trend, so kind of the trend we'll use within 2025 going forward, is a little bit lower at 8.4%. Our claims experience in 2023 was generally favorable, which led us to take a mid-year decrease on 2 of our 2 biggest entities, on the UHIC and MLH entities, effective 7/1/24, and that helps explain why the majority of our small groups are receiving a rate increase that is lower than trend. So then turning to the individual market, United Healthcare is continuing to offer policies on the individual exchange after re-entering the market in 2021. We are selling plans statewide under the Optimum Choice Incorporated license and offering 16 individual HMO plans in 2024. Those break down as 4 gold, 7 silver, and 5 bronze, and all of the associated CSR silver variants. We submitted our 2025 rate filing with an average premium increase of 6.7%, which I think from what Brad said earlier is pretty middle of the pack as the increases go. And please note again that this is an average and the actual rate change will vary based on the plan selected and other factors. The primary drivers of our rate change are changes in experience, the application of additional year of trend, changes in expected demographic and metal mix of our population, and changes to non-claim expenses. So hopefully this summary of both our small group and individual filings has been helpful, and I'd be happy to take questions if you have them. Thank you.
Thank you. And now we're hear from WellPoint.
Hello. Thank you to Acting Commissioner Hatchett, Chief Actuary Bobbin, and the Maryland Insurance Administration for the opportunity to present today. My name is Jason Margus. I'm the actuary with Elevance Health, which is the parent company for WellPoint, Maryland. With me today is Kathleen Lovren. She's the Senior Director of Governmental Relations and Business Development. And at this time, I'll turn it over to Kathleen for a few introductory comments.
So good afternoon, everyone. It's nice to see you. And I'm very pleased, along with Jason, to be here today to announce entry into the individual market in 2025. As many of you know, we have participated in Maryland's Medicaid program since the inception of Health Choice. We have remained a leader in that space and are fully committed to continuing to serve our Maryland Medicaid recipients. We believe that this entry into the ACA market will provide further enhancements to Maryland's healthcare market and give individuals and families greater choice and access to quality of care. It is our hope that we can continue to serve in this marketplace as we have done so to date in the Medicaid space by providing a high level of service to Maryland residents. And let me turn it back to Ryan. I'm sorry, to Jason for his comments.
Thanks, Kathleen. Okay, so in 2025, we will be offering 10 open access HMO plans in the individual ACA market, and these include the Maryland Value Standard plans. Our plans will be offered both on and off the exchange, and they span a range of metal levels, including catastrophic, bronze, silver, and gold. We have developed what we believe to be a competitive, accurately priced product portfolio, and we've based this upon our review of publicly available data as it relates to the Maryland individual ACA market. And in addition, actuarial rate modeling using our individual market experience from 12 of the states in which we currently offer products. And this experience represents approximately 7.3 million member months in 2023. We further supplemented the data with information from Milliman's health cost guidelines. So we have adjusted the historical individual experience to represent future expectations using an annualized trend of 6.4%. And we've also adjusted for the projected demographics, population morbidity, enrollment by plan design, unit cost, and utilization patterns. Finally, we have adjusted the rates to consider the impact of the ACA risk adjustment program, Maryland's state-based reinsurance program, administrative costs, profit, taxes, and fees. Maryland's state-based reinsurance program is notable. It had a significant impact on our rate development. Without this program, our filed rates would have been approximately 32% higher. And that concludes my remarks. I hope that this review of our product portfolio and the pricing approach has been helpful. We look forward to providing more information in the coming months as the open enrollment period approaches. Happy to address any questions that you may have. And thank you very much.
Thank you both. So now that ends the comments from the various carriers. Now I have listed here one pre-registered interested party that would like to make comments on behalf of MHA.
Good afternoon, Acting Commissioner Hatchett and MIA staff. My name is Tequila Terry, and I'm the Senior Vice President of Care Transformation and Finance at the Maryland Hospital Association. On behalf of the Maryland Hospital Association's member hospitals and health systems, we appreciate the opportunity to comment on the proposed individual and small group market insurer rate filings for plan year 2025. At the outset, we'd like to emphasize that the price of insurance premiums influences the ability of patients to purchase coverage. And without adequate coverage, patients refrain from accessing timely care, which adversely affects health outcomes. Now is a really critical time to ensure healthcare cost affordability for all Marylanders. Under Maryland's unique federal arrangement, the total cost of care model, and moving into the new federal model, the state's advancing all-payer health equity approaches and development, also known as the AHEAD model, hospitals are working hard to control costs while delivering quality care to all patients. And we want to see the significant cost savings derived from the hospitals passed along directly to Marylanders. Carriers play a critical role in ensuring costs are managed and healthcare is affordable to consumers. And so we really appreciate the opportunity to weigh in on today's conversation. We support the Maryland Insurance Administration's mission to regulate proposed premium rates so they're not discriminatory or excessive. And we'd like to offer 4 points for your consideration. One, the proposed premiums are significantly higher than hospitals' annual payment update. As hospital services are a significant component in health insurance benefits, we urge MIA to require insurers whose rates exceed the hospital annual payment update, which was recently approved at 4.53% for rate year 2025. We'd urge you to get the carriers to explain the discrepancy. The second point is that carrier rate requests should be more transparent and accessible. The process for rate requests needs to be based on an equation that is transparent to the public and can be easily understood by key stakeholders. Filing should clearly explain carriers' assumptions, the models, the reasonings to assist all consumers in understanding the purpose of carriers' intended rate increases. A model for doing this already exists with the hospital rate request process through the Health Services Cost Review Commission. The third area that we would offer for consideration is around denials and prior authorization processes, and that these really must be further examined. Before rate increases can be considered at the current requested level, denials and prior authorizations really have to be considered as part of the process. Consumers are regularly plagued by long, unnecessary prior authorization processes and denials that are then overturned by third-party reviewers. Based on the annual report in the Health Insurance Carrier Appeals and Grievance process completed by the Office of the Attorney General in fiscal year 2023, of the grievances MIA investigated against carriers, a staggering 69% were modified, reversed, or overturned. And in 2023, of the grievances that were filed with MIA, 60% were overturned. So surely this is an area that deserves additional attention. And then fourth and finally, we would encourage broader understanding of how high deductible plans combined with the carrier rate increases affect Maryland households' overall costs. High deductible plans must be considered in conjunction with premium rate increases to determine how these increases affect overall costs to Maryland households. Higher out-of-pocket obligations may cause some patients to refrain from accessing timely care, which adversely affects health outcomes. And so across these 4 areas, we would really implore the state to ensure that there is carrier accountability and transparency to reduce costs for patients, to facilitate and improve health outcomes, and to align with the goals of the unique federal model that Maryland is a part of. We thank the Maryland Insurance Administration for the opportunity to comment, and we look forward to continuing our work with MIA to make healthcare accessible and affordable for all Marylanders. And I'd welcome any comments or questions.
Thank you so much. At this point, that is the only person that we had that pre-registered for comments. If anyone else would like to make comments, please enter your name in the chat and Mr. I will bring you over so that you can make those comments. And while we're waiting for anyone, just want to make a couple of closing comments. First of all, as noted, this recording, as well as any comments, will be available on our website within the next few days. Also, the opportunity to make written comments will be available until August the 9th. And I believe that's all of the closing comments that I have. Brad, did you have anything else that you wanted to state at this point in time?
No, I didn't have anything else. Like you said, written comments are still being accepted through August 9th. So we will read and consider anything else that comes in after this date, as long as by August 9th.
And at this point, we are anticipating issuing the determination on the rates by early September. So you do have a little bit of time in order to get those written comments into us. Craig, did you have anyone that indicated in the chat that they wanted to make any comments?
No, I'm not seeing anyone.
All right, then. Well, once again, thank you so much for joining us this afternoon. Thank you for all of the carriers and as well as the representative from MHA for speaking this afternoon. And everyone, enjoy your afternoon and the rest of your summer. Thank you.